Hello, I'm Dr. Vincent La Placa, Associate Professor of Public Health and Policy and Associate Head of School for Student Success in the School of Human Sciences at the University of Greenwich in London in the UK. And I'm giving the keynote presentation, Social Science Theories in Global Public Health. So thank you very much for tuning in and engaging with the presentation. I'm going to briefly talk about the shift to social science in global public health studies, then discuss what social science theories are and what they seek to achieve, and then articulate and briefly discuss some social science theories being used across global public health currently. So to begin with, traditionally global public health has been perceived as rather biomedically orientated. For example, it's concerned with the physical, with physical disease, with externalities, with only what we can observe. So it comes to global public health from a rather clinical approach. But recently, there's been a growing recognition that global public health is far less narrow than this and requires a broader shift to the social sciences. For example, uh, if we're going to look at health inequalities in societies, health inequalities between different countries, how different groups experience health and well-being according to their location in the social structure and experiences, for example, of poverty and inequality, we really need to approach this through social sciences. And as you know, social sciences embrace, for example, sociology, anthropology, law, psychology, public policy, and even economics and studies. So a key challenge of this shift has meant that global public health practitioners and researchers are required to use social science theories in their research and also to embrace the findings often of their research as well. So, what are theories? What are social science theories? Theories are holistic explanations, systematic and reflective explanations of how social systems or societies work and function, how they stabilize over time, explanations for how they change. They articulate how the distinctive parts and domains of a social system come together and specify what they are, what we often refer to as stipulative conditions. Uh, Social theories also talk about how social systems and societies operate and change as a result of movement between the above, as articulated by the theory, and we often refer to this as dynamic conditions. Social theories also allow us to develop a hypothesis and and test that hypothesis and that theory. And as you know, a hypothesis is a proposed explanation or a supposition that we can test using research. So broadly, that's what social science theories are. Moving on, theories organise explanations and research findings often into what we call macro structures or collective orders. Uh, these are the larger macro structures and contexts which are organised around wider social determinants and structures. For example, income, political systems, inequality, those wider social structures that are often beyond human action and arrange and pattern human society and human behaviour. However, social theories also articulate individual actions based upon agency and human consciousness. So, whilst we all live in societies which consist of wider social determinants for example, which influence our behaviour and are above and beyond us. For example, income and poverty, as I've said. Human beings have agency and consciousness, and this agency and this consciousness allows them to negotiate those social structures. So, for example, Marxism is often more concerned with macro structures and how the structures of society influence our behaviour, whereas something like symbolic interactionism or social constructionism is more or less concerned more with human agency and how humans negotiate and create society. Theories also illuminate and rationalize ontologies. So they explain what is, as you probably guess now. They classify, they categorize, they explain what is. They tell us what is. What is society? What is a social system? What does it comprise of? This then allows us to develop epistemologies. And as you probably know, an epistemology and epistemologies are the theory of knowledge. How do we know something? How do we know how something happens? And of course, this then goes on to shape the types of research methods used. So theories, social science theories, uh, uh, allow us to look at ontologies, then epistemologies, and then that often influences the types of research methods that we use in order to study society and global public health as well. So let's just briefly look then at some of the social science theories that are being used in global public health and public health generally at the moment as we shift towards the social sciences. Uh, One significant theory or theoretical framework which many global public health researchers and practitioners are using is the theory of critical public health. Now, critical public health focuses on the macro. It focuses on the larger, wider determinants of society, which often create structural inequalities in health and illness between people. So it often looks at society from the macro perspective. It looks at how economic inequalities translate into health inequalities. So it looks at society as something which is often structurally beyond individuals, focusing on inequality, focusing on poverty, focusing on inequality, and how societies are often arranged and used uh, in order to create those inequalities. It's critical towards healthcare structures and institutions. It emphasises this concept of social suffering, whereby healthcare institutions and the way society is arranged often create suffering for individuals beyond viruses and bacteria and physical disease, and looks to society to see how society and the way it's organised often creates social suffering and influences inequalities and the social suffering that occurs because of that. So critical public health, it's really looking at empowering people. It's looking at how society creates inequalities, which then translates into health inequality. Social constructionism is a theory which is often now used in global public health. For example, this tends to focus on the micro, how society is constructed through human interaction, human language, how human beings construct meaning and discourses and negotiate the world. Discourses are practices and languages which form the objects of which they speak, and they refer to a set of narratives and sets of meanings of a subject. For example, Foucault's concept of medical and psychiatric discourses. So illness and disease is not something which is simply biological, it is socially constructed. It emerges often the types of illnesses that we categorize in society, the way we treat them, the way we view them, it's created, they emerge, they are not discovered through biomedicine. So social constructionism looks at human agencies, how humans construct the world, how humans bring disease, how humans bring death, and concepts of death and how we deal with death into into society. So a very interesting theoretical framework, you know, when we consider how disease is not only biological, but it's created and it emerges as well. Feminism is also a significant theoretical framework which is now being used in global public health. As you probably know, feminism takes a very macro look at society often, that society is structurally organized around patriarchy, ruled by the father, that society is organized largely around men's oppression of women and women's experience of the world and of health and illness and public health is experienced through male domination. So gender is the main point of health and illness when we take feminism into consideration. Gender inequalities for feminists translate into health and well-being inequalities between men and women. So research and people who use feminism, they often focus on women's subordinated experiences of healthcare systems and their positions within healthcare, often looking at, for example, domestic violence, sexual violence, and the subordination of women in healthcare institutions. However, whilst this is very macro orientated, often some feminists often look at women through agency, through practice, and how women organise and negotiate their lives as independent agentic beings, and how they negotiate and try and make things better for themselves within the wider social structures of patriarchy. So just to conclude then, uh, the shift to social science in global public health means researchers and practitioners need to engage with social science theories in research policy and practice. Global public health goes beyond the traditional biomedical view of physical bodies, physical health. Health is something which is there just to be studied, for example, through through externalities, through observation. If we're going to look at health inequalities, inequalities between people, how society creates inequalities, we need to move towards social science theory. And I've articulated some theories which are available to use. There are, of course, other social science theories that can be used in global public health, which you can go on and look at yourself. For example, structuration theory, Giddens' theory of structuration, looks at how human beings on a micro process construct wider macro processes, and in turn how those wider macro processes then go on to give us resources to create further micro and macro processes. So the use of social theories broadens global public health beyond traditional biomedical approaches. Uh, I hope you've been able to engage with this well, and I hope you've been able to to come in and engage and think about how social science theories can assist us to create better and more effective global public health and social science research and practice in our daily lives and our daily works. Here are some of the references that I've referred to, which you're welcome to go back to and have a look at a little bit later if you so wish. But thank you very much for listening to this and engaging with this. And I hope you go on to enjoy the conference further. Thank you very much for listening again. Thank you very much.